we go. And we're going to go to speaker view. Good morning, everybody. Good afternoon, actually, I should say. Welcome to our continuing series on Medicare. And we're glad you're here today. We have a couple of things I'm going to take just a minute to set up so that we don't have any interruption. There we go. Good. All right. So welcome today. We are here today to talk about Medicare versus Medicare Advantage, which, as everybody knows, you're getting bombarded in the phone and by email and in your post office box right there on everything about Medicare and Medicare Advantage. So that was one of the things we want to talk about today, because you have the decision at this point to decide to move from one to the other or different Advantage plans up until December 15th. Also coming up in November, we have another fall prevention class taught by myself and Maria Francis. And then we have our holiday party, so save the date on December 10th. If you're here in Santa Fe, we hope you'll join us. And Brad, if you will forward the slide just there, that'd be great. Coming up Tuesday, I'm sorry, we have a free Halloween Monster Mash class, our exercise class with Maria Francis. We hope you'll join us. All you have to do is send us an email there at info@Villages of Santa Fe, or you can log in and go to our website and click on join, and you can join that class. It's going to be lots of fun. All right, next slide. So what we do, so Villages of Santa Fe, we are interested in keeping our older generation healthy, and that's very critical to us. Every year, 1 in 4 Americans age 65 and up fall, and falls are the leading cause of fatal and non-fatal injuries among older adults. Exercise is the only way to prevent falls. Villages of Santa Fe makes exercise and lifestyle programs available for older adults 24/7 through our online and in-person classes, workshops, and a library of over 600 videos. We want to thank Nurses with Heart for providing us with this space. And if you have any questions, we will have a Q&A at the end, and you will be able to unmute yourself and ask questions, or you can put your questions in the chat. Next slide. So who's with us today? Yeah, that's Brad. So Brad Coe is the president and managing member of Coe Agency, LLC, with his business partner and wife of 15 years, Amanda, and his daughter, Emily. Since Villages was founded in 2016, Brad has provided insights into the world of Medicare and helped many of us individually. Brad has been in the insurance industry for over 22 years, and his group, he actually focuses on Medicare, while Amanda and his daughter handle their group insurance. So I am actually going to turn this over to Brad and go for it.
Thank you, Ann.
You'll go to the next slide. Good, there we go. That's your slide. Let me change microphones just a moment.
Good afternoon, everybody. Thank you for joining us. I really appreciate this opportunity to go over this. And I think when Ann ended up coming to me and asking me about doing a presentation on this, it kind of clicked like, yes, this would be a very good one, because typically I will go ahead like we did. The last one was a Medicare 101, but now we've got enough people who are seasoned enough into Medicare to now kind of be looking at it a little bit more advanced. And this is a more advanced way of looking at it. The thing that a lot of people coming in to Medicare tell me is that it is so confusing. And it's not actually that confusing. What becomes confusing is that there are components of different things, ways to administer Medicare that are developed and administered by private insurance companies. So when we now move into the private sector, now we need to start talking about or taking into consideration that marketing and advertising and profits are all part of the discussion that comes in when we end up doing private insurance companies. So when we introduce some of these things now, okay, there's aggressive tactics or more aggressive tactics about contacting you. Everybody that I talk to is getting significant things in the mail all the time and significant amount of phone calls. It's actually very disruptive, but it is part of what the system is at this point. So what we're going to go ahead and do today is again building it on a simple platform, and then understanding the differences. And there's not a lot of differences with them, but there are some key differences that we need to point out. And I think that really, when I'm discussing this, it comes down to only one or two things of where the priority is for that person for suitability, which is the word we're looking for. Medicare wants not what's the best plan. The best is a subjective term. The suitability is the one that's going to go ahead and suit that person best. So one of my favorite slides here is this pretty much tells everything. There are two ways that we can administer Medicare. You end up administering Medicare with Original Medicare being the primary insurance company. And that's what you need to think of them as an insurance company. And what we have is Medicare is comprised of four components: Part A, Part B, Part C, and Part D. Part A and Part B is Original Medicare. So that's the foundation. Original Medicare is the foundation of everything that we do. Now, what we do with the other two parts, that's it. If we decide to go ahead and keep Original Medicare as our primary insurance, now we have Part A, which is hospital, once you're admitted into the hospital and admission into skilled nursing. B is medical, and that includes everything from I'm not admitted in the hospital and it's not a prescription. So everything in between there is lumped under the medical. But we don't have prescriptions. We don't have outpatient prescriptions. And we'll get into this, but there ends up also being some exposure there that we'll discuss a little bit later on. But if we decided to go ahead and do Part A and Part B as our insurance, as our primary insurance, we should go ahead and put a prescription drug plan. That is voluntary, but you will pay a penalty if you come in later on. And then we will briefly touch on this on one of my last slides about adding the Medigap because of the exposure that we're looking at with Original Medicare. The other way to administer, so that's one way. The second way is through Part C of Medicare. And Part C of Medicare is actually a program. It's not a benefit. It's not inpatient. It's not medical. It's not prescription. It's a program. And the program is that private insurance companies can develop their own Medicare plan. It's got to be as good or better than Original Medicare. So you do not lose any benefits, but they tally them differently. So that's just a different way of skinning the same cat, so to speak. So when we do something with Medicare Advantage plans, they encompass and package everything together. So it looks an awful lot like a plan that you might have prior to age 65. We're not looking at a separate hospital benefit. We're not looking at a separate medical benefit. What we're looking at is, okay, what's my copay for going to the doctor? What's my copay for my prescriptions? What happens when I go into the hospital? What do I have to pay? And this is all packaged into one policy. Now, here is probably the most confusing part is you have to have Part A and Part B in order to have a Medicare Advantage plan. So you got to forget what I said over on the first side of primary insurance. Even though original Medicare is active, you do not access any care from them. Even though you're going to be paying still your Part B premium, your Part A premium, if you have it, if you're not entitled, you never access your care from original Medicare on this. The Part C or Medicare Advantage plan from the insurance company basically umbrellas over the original Medicare, and they then become your primary insurance. Now, the insurance company may go back to original Medicare and get their reimbursements from them, but you will never get your care from original Medicare. It's through that insurance company. So that becomes kind of the most confusing part, is that you have your insurance primary over on this side as original Medicare, and over here you have original Medicare still, but we push them kind of in the shadows, and the insurance company's Medicare Advantage plan comes in, and then that becomes our primary insurance. So that one of the biggest issues that we end up having with the difference between original Medicare as your primary insurance and a Medicare Advantage plan as your primary insurance is, I'll use the word network. They don't really like me to use the word network because Medicare doesn't really contract with doctors. They just kind of go out and say, will you accept it? And they will either agree or not agree. But that's the vernacular that we're used to using. So please don't anybody report me that I'm using the wrong words here. But the network that you have, so who you can go see as a provider on the original Medicare as your primary insurance, is anybody nationally that accepts Medicare. So now when we're living in a community that might have two competing hospitals, okay, more than likely both of those hospitals accept Medicare. So now you can go to either of them, and there is no difference in what your benefit is from going to one to the other. They just have to accept Medicare. And if they accept Medicare, then I go there and I get my service. If I decide to get a second opinion outside of my home state, well, again, I'm not paying differently when I go to another doctor. I end up still paying what original Medicare, where I am in my benefits on original Medicare. Now, for a Medicare Advantage plan, once you start to introduce an insurance company, now we start to talk about the network in its classical form here, where they're getting contracts with providers and they're negotiating reimbursements with that. So the insurance company wants to direct you towards those providers because that's how they can control their costs and their benefits better. So that really kind of becomes, so in our example of a community that might have two competing hospitals, okay, we very well could end up having one Medicare Advantage plan from an insurance carrier where you can only go to one of those hospitals and you've got to get, and you can't go to the other hospital. So again, over here on Original Medicare, it's anybody who accepts Medicare. Now, if they don't accept Medicare, okay, now you have no coverage. So they have to accept Medicare. Over here on this side, on the Advantage side, we start to talk about what is that insurance company's network. And we deal with two types of networks primarily. There's others, but I don't want to muddy up the water. The two are a health maintenance organization, an HMO, and a preferred provider organization, a PPO. With a HMO, we have a more, I want to choose this word carefully, confined network. So they've really boiled things down and said, here are the doctors you can go to. And typically in these plans, they have a lot of value in them for the trade-off of saying, I'm just going to use these particular doctors. Typically, this is only a regional network, and the PPO typically has a national presence, so you can get care outside of New Mexico. And if the provider accepts that insurance company, is contracted with them, is in network, then you can still go to them and have the same in-network benefits. But there'll be a second set of benefits. And the second set of benefits is if the provider is not contracted in it, and they accept Medicare. So they've got to be able to still accept Medicare Advantage plans. So I might not take ABC Insurance Company, but I take DEF Insurance Company. So yeah, if you want to come to me and work in the second set of benefits, we call it an out-of-network benefit. Now, this tends to be a lot less than going in network, which circles us back around to what I was saying, because of they're trying to control their costs. The insurance company can control their costs by using contracted doctors, in-network doctors, whereas if you're going outside of it into another doctor, now suddenly they can't control the costs as easy. So this is a big thing. I give an example of a funnel. When we're at Original Medicare and I can go to anybody who accepts Medicare, we are at the widest mouth of the funnel. When we come over to the Medicare Advantage side, well, an HMO is going to get us into a more thinner part of the funnel, and the PPO is going to bring us somewhere in between. And that's how you can kind of visualize it of what you're doing. And here I'll slip this in probably numerous times. This is where the insurance companies typically have numerous Medicare Advantage plans. So you might have one insurance company that has two HMO products. They might have two PPO products. We're talking about they're needing in your area. So everything's going to be area based with the Medicare Advantage plan. They call it your service area. That's why everybody ends up asking, what's your zip code? So we can tell what plans are available. But where the confusion starts to come in is when you get a mailing piece from ABC Insurance Company and it tells you, hey, you can get all of this stuff for $0 premium. Okay, that makes sense. The next day, you get another thing from ABC Insurance Company and it says, hey, we've got this great Medicare Advantage plan and it's for $20. And you're like, well, wait a minute, I just got something yesterday that said it was $0. Now this one is saying it's 20. Okay, they're advertising specifically two different products. One of the product most likely is the HMO, the zero, because again, a lot of benefits come in there. The other one is going to be your PPO because they're going to lose control of some of their costs by having that option if you use it. So that's where we're going to start to keep plugging in here. This is where the confusion comes in. So by studying a lot of things about on Medicare Advantage plan, you're not learning more about Medicare. You're just learning more about that particular insurance company's Medicare policy. That's the difference. And referrals, again, we get back to the control situation. Over here on the original Medicare, you don't have to go ahead and get referrals for original Medicare to go ahead and pay for it. Now, that's not to say that a specialist doesn't want you to get a referral from or have a referral from your primary care. That's all the medical internal stuff. But for your insurance company, original Medicare, you can go and see another doctor even outside of your home state, and you do not have to get a referral for it. When we do talk about the Medicare Advantage plans, a lot of times there are referrals that we have to look at. We have to look at prior authorizations. There are some prior authorizations over on the original Medicare side, but this is being administered by the Centers of Medicare and Medicaid, and they tend to be a little bit more lenient than an insurance company who is, again, concerned about all of those things that we talked about originally, like in order to do business. So we do need to go ahead and check and see if there's a referral for one of these. And an HMO product typically wants you to have a primary care physician, a PCP designated. And that becomes the word we've always used as a gatekeeper. So this is who you funnel all of your care to, and they then will go ahead and direct you into those areas. So again, not a huge difference, but it ends up being a difference. Maybe a larger network, more providers available to you, ease of going to a doctor without having to go through what maybe red tape. But over here, we do gain a lot of benefits on the has to be as good or better than Medicare. On Part B, this will give us a good example. On Part A and Part B, they have a schedule of benefits. Part B is always easier to explain because it's not so choppy. On Part B, with your medical, you have a deductible. This year, the deductible is $226. You are going to have to pay the first $226. Now, once you hit that $226, then you're going to share in the cost. You're going to co-insurance. That's where they come up with that word. And your portion is 20%. Centers of Medicare and Medicare, or original Medicare, their portion is 80%. So if you had $1,000 service done, you would pay the first $226, and then you would split it 80-20, the other 700 and 476. I think I did my math right. Sorry. So it's something to think about. And what we will get down to is, if I could jump to it so that, because we're kind of on this, is there is no limit, no yearly limit on how much you can spend on that co-insurance. So this is where we get where we get a little uneasy, because on original Medicare, okay, $226 isn't hard for me to understand. 20% for me to go ahead and pay, that's not hard for me to understand. I can go ahead and afford this. What happens is there is no place that the 20% stops. So if we end up having a $50,000 outpatient procedure, okay, I'll pay $226, and now I'm paying 20% of this 50,000. And now suddenly I got $10,000 in a bill, and we're still not done. And that's not even talking about, the same thing is true about Part A. They don't have, they've got certain more specific things, like you go into the hospital, it's this deductible, you go into skilled nursing, but there is no place, there is no yearly limit. And that's where we get a little concerned, because we're on fixed incomes. What happens if I do get that large item? With the Medicare Advantage plans, they have to have a yearly limit. Now, the federal maximum in 2024 is, I think, $8,080. So there are many plans that have less than that $8,000 mark. And again, this is to entice you to come and be in their on their plan. When we start, how do we get to that limit? On a Medicare Advantage plan, I just told you how original Medicare works for medical. Let's say medical, your deductible, then your co-insurance. On Medicare Advantage plans, everything has a copay or a deductible. Again, they look like our under 65 plans. So if a service has a copay for it, well, when you have that service and you're going to a contracted doctor, then you will pay that copay. If it doesn't have a copay and there's a deductible, okay, then you would go ahead and end up paying that. You would end up paying that co-insurance or the deductible until you hit that deductible limit, and then whatever's going to happen after that. So they add up the co-pays, they add up deductibles. If there's a co-insurance on this, they add that up. And that would be how you kind of get to your annual yearly limit. They'll call that the MOOP, maximum out of pocket. So that's where we start using terms. If you've talked to anybody on the phone, they start throwing out all kinds of jargon. MOOP is what that word is. As we said earlier on that first slide, you're still going to have to pay your Part B premium on both sides of this. So you will never lose that Part B premium. When we get down to the bottom here, you can get a Medigap policy. So when we were talking about original Medicare and that there is no limit then, or maximum out-of-pocket limit, yearly limit, that's where we usually interject or say we can go ahead and add a Medicare supplement plan. Again, we'll touch on that briefly on the last slide, so I don't want to take up a lot of time. You cannot, though, over here on the Medicare Advantage side, you cannot have a Medicare Advantage plan and a Medigap. You have got to have one or the other. And again, here's where we get a little confused. So I had an example of a client who went to a facility outside of New Mexico, and the facility said, we do not take Medicare Advantage plans. Well, he comes up with the idea that, well, I still have my red, white, and blue Medicare card. I'm still paying my premium. So this is still active, which is true. It's still active. So he goes back to the provider, gives them his Medicare card, and they go ahead and start punching him up in the system. The system will say he's got Part A and Part B or original Medicare, or he's got a Part C plan, a Medicare Advantage plan. You cannot have both. How do I say? You will not have both of them administering the benefit. On this side, it's going to be original Medicare. On this side, it's going to be the Medicare Advantage plan. So that's how they keep track of this. So even though it's active, your original Medicare is active, you will never get any benefit from the original Medicare. Unless one little caveat is when you go on to hospice, then Medicare usually comes in and takes over at that point. But other than that, there is pretty much no way that you will get any benefit from original Medicare on a Medicare Advantage plan. Original Medicare was developed on the old school of insurance, medically necessary. So really, when they start to talk about anything that happens, it's based on, is this medically necessary? So interesting fact, on original Medicare, physicals aren't covered. They're not considered medically necessary. But so how did they do this before the Medicare Advantage plans came out in the mid 2000s there? They would code everything as an office visit. So an office visit is covered, but if you coded it as specifically as a physical, okay, then it would be not covered, a not covered service. So it's gotten a little bit more developed because there are preventive pieces that came in the early 2000 teens, and that is good. So they have yearly preventive things. So it does include prevention now, but as with all government things, you have to look at what your requirements are. Sometimes you can get this screening every year. Sometimes you might have to wait 2 years before you can get the screening. So it's something to think about, but that's kind of how it's set up. So when we get back to that example of, hey, I want to go on a second opinion outside of my state or even to the competing hospital, okay, I don't have to get a referral, and I can go ahead and I'm ill. So this more than likely will be covered by Medicare, original Medicare. When we get over to the Medicare Advantage side, we're talking about medically necessary, but extra benefits that original Medicare won't have. So here's the thing that is where a ton of value starts coming into these Medicare Advantage plans, is that you have this one plan and they can add things like vision, hearing, and dental services. So on original Medicare, if you've got cataracts, medically necessary, you can get an eye exam and they will cover these things. On this side of things, okay, they'll cover the cataracts depending on what your copay is and stuff, but you also have a separate actual vision benefit. So if you want to just go get your eyes checked and get some glasses, we've got it. You dental plans, okay, I just want to go in and get my twice a year preventive. They have these embedded in them. The piece that I would caution again is when we're talking about the Medicare Advantage plans, everything is network based, everything, including the vision, the hearing, and the dental services. So it's never carte blanche, just go to whoever. There are some plans that might have allowances that you can use, but you get better pricing if you go to their network. But in essence, you're still having to the vision, dental, and hearing are still going to be in a network that the insurance company, and here's confusing part here. Another confusing part is, okay, we've been talking about ABC Insurance Company, and we've been going to doctors who accept ABC. In my policy, I have a dental plan. Okay, do I go and find a doctor who takes ABC Insurance Company? Typically, no. Typically, your policy, your insurance carrier has contracted with another company to administer all of this. So you need to find out what network they use, and then that's who you're asking for when you end up calling that dentist. Hey, dentist, I have ABC Insurance Company, but they are through Joe Schmo Dental. Do you accept Joe Schmo Dental? Yes, we do. Okay, then you can come and you can get your dental services here. No, we don't accept Joe Schmo Dental. All right, well, if you come here, you're going to have to pay out of pocket more because we are not contracted. So everything is network based. You have to always remember that. So it's important on your Medicare Advantage plans is to be sure you know where you're supposed to go the vision, where you're supposed to go for the hearing, where you're supposed to go for the dental, or else you won't get coverage. And if you decide to move from one Medicare Advantage plan to a different one for the annual election period, well, now all of that changes. Now we're a DEF insurance company and they use chill pills and dental. And now you've got to go ahead and take all of that stuff into consideration. Now I say this, and I don't want to make it sound like this is a real laborsome piece. It's something to take into consideration. But by putting forth a little bit of effort and knowing what to ask for and look for when you get your new notice of annual coverage, the ANOC, then you can go ahead and see about what you're getting yourself into. Because now we used to just say, okay, what prescriptions are you on and who's your doctor and what hospital do you want to go to? Now we're asking those three things, but we're saying, okay, who's your dentist? Who do you go get your vision from? Do you have a hearing aid? Do you have an audiologist that you have? We are taking into consideration all of these things because what should be done is that if you're going to go into this policy, suitability means that you can use all of these services at the providers you just mentioned to me. And if you can't, then you need to make sure you have to understand that you don't have coverage then. Okay. A lot of times with the Medicare Advantage plans, the prescription drug is included in it. So again, here we have all of this where it ends up being where we've got the medical, we've got the hospital, we've got hearing, vision, dental. Well, they also have the prescription drug plan. So if you go back to, I don't know if I can go backwards.
You're waiting.
Oh, sorry.
Don't worry. You're the other side.
If we go back to this slide, okay, we're piecemealing it together on this side because over here, hospital, inpatient, medical part B, if we want prescription, we need to get a separate prescription drug plan. So we're not really talking about that, but that adds to your confusion when you're getting mailing from the ABC Insurance Company because they sent you something 2 days ago on the HMO. They sent you something yesterday on their PPO Medicare Advantage. Now today they're sending you something on their prescription drug plan. So we piecemeal it together where we have part A, part B, part D for your prescriptions. And then a lot of times we'll put the Medigap in, or it's also known as a Medicare supplement plan in curb that that exposure, hedge it. Over here, everything is included in what we're talking about. So these, again, the Medicare Advantage plans sometimes have premiums. There are an awful lot of Medicare Advantage plans that have a zero premium. So here's one of the big, huge values of a Medicare Advantage plan is that you end up having your medical, your hospital, prescription, dental, hearing, vision, all of this for a policy that is costing you zero. Now, when you go to use it, okay, you're going to have copays. So you're going to have out-of-pocket expenses at that point. But on a monthly basis, you don't have a premium payment for that. You're still paying for the Part B out of your Social Security, or they're sending you a bill, but you don't have a premium for your policy. So you can see where the value is in this. And we talk about the extra benefits as dental, vision, and hearing. Honestly, that's almost limiting now. That's almost too limiting now. They have benefits like over-the-counter benefit. They'll give you the insurance company will give you a quarterly allowance to spend on non-prescription pharmacy items. They typically always have a gym membership in them. There are benefits like there's a flex card that's becoming very popular. It's a Visa card, and they will give you money on that flex card for your over-the-counter benefits, or you can use it for dental, hearing, and vision. So on the dental, hearing, and vision, okay, if I get my tooth pulled and that's a 80-20 split, I still have 20% that I have to come up with. Oh, they've given me this flex card that I can give the dentist, and they can go ahead and put that on here. They're getting to the point where on these flex cards, where you can even, especially if you are dual eligible, Medicaid and Medicare eligible, some of these Medicare Advantage plans now will let you spend this money on healthy food. They'll let you go into certain stores to go ahead and use your flex card in there. If you go into, I don't know, can I use a name? If you go into CVS, you'll see that there's this OTCH on all the labels. If you have that, that is an over-the-counter valid product. They'll let you use some of this money on the flex card for rent, sometimes gas. So I mean, there's so much value in this, and you're paying zero, but you have to work within our contract and go to our people. And that's the trade-off. That's the trade-off that we have. And again, when we start to talk about insurance companies, we're back to that referral. A lot of times you're going to have to get approval for a lot of things. And you are going to have to get approval on the service and supplies over on original Medicare. But again, what I've been told, let's say it this way, that it typically doesn't take as much to get things approved over on this side of things as over here, where you have an added layer of insurance that has their own requirements set up also. Original Medicare does not cover you outside of the United States. So, you know, you eat some bad pasta in Italy, you got to go to the emergency room. Okay, that is not going to be covered. There is a piece of the Medicare supplement plan that if we did that first slide and we did this four-legged stool on there, that has for emergency services outside of the United States. Medicare Advantage plans, again, some plans may offer supplemental benefits, but they typically don't offer you regular care outside of the United States. Now, emergency room and urgent care is typically covered worldwide. So if, as long as it's an emergency, so we're in Italy, we go to the emergency room, you have your Medicare Advantage plan, okay, you're not going to go ahead and give it to the hospital because they're going to be looking at it like we don't even know what this is. You would have to pay for it up front and then bring it stateside and then submit that claim on your own. So that's how it ends up being covered. But a lot of people say, well, if I go on an HMO, well, then I don't have any coverage outside of my service area. And that's not true. You just have only emergency room and urgent care coverage. So go visit the sons and daughters and grandkids and stuff, and don't worry about that. But if you wanted to go back for a second opinion to your old doctor in your old state, no, that's where it's not going to happen. So when we talk about the original Medicare, we typically are going to go ahead and add a Medigap or Medicare supplement plan. These are all standardized. They are offered by insurance companies. So here is another reason why you're getting bombarded. We've been talking about ABC Insurance Company sending us something on their HMO Medicare Advantage, their PPO Medicare Advantage. Oh, then they sent us something on their prescription drug plan. Well, now today they're sending us something on their Medigap plan, their Medicare supplement plan. Now, these typically have a higher premium. Okay, so this is where things kind of tip the scales. So we can piecemeal this stuff together on the original Medicare. We're paying our Part B premium. We've got a premium for the prescription drug plan, and we've got another premium for the Medigap plan or Medicare supplement. On our Medicare Advantage plan, okay, everything's included in there. So you're just paying your Part B your Part B Medicare premium, and that's it. So when we get into Medicare supplement plans, again, Medigap plans, this is only for original Medicare. You cannot have this with a Medicare Advantage plan. They're offered by insurance companies. They are standardized. You are not going to go ahead and get anything from one company that you're not getting from the other. The highest benefit plan that's offered now, if you turn 65 after January 1st of 2020, is Plan G. And if we go down the list here, we'll see that, okay, if I've got original Medicare, do not be thinking about a Medicare Advantage plan and say, well, I have a $35 copay for going to the doctor. Okay, you're thinking Medicare Advantage. We're talking if you have original Medicare, then it's going to go ahead and pay 100% of everything except for the Part B deductible. And that got taken out about the mid-teens. That was part of the negotiation, let's say. And so now that's why I'm always hammering people to keep an eye on what the Part B premium is going to be, because it keeps creeping up. It keeps going up. It might be affordable or you might be manageable now, but as this snowball keeps going down the hill, it's going to get to a place, if we're not careful, where we aren't going to go ahead and be able to handle this. So we're on a Medigap plan, even though it's from an insurance company, it's their only product in which you don't, well, let me word it differently because somebody will know about another type of design. it does not have a network associated with it. So let's say ABC Insurance Company has sent us, we get their Medigap plan. Okay, we don't have to go to now ABC Insurance Company's doctors, even though it's offered by ABC Insurance. We don't go to their doctors. The only requirement that a Medigap plan has is that Original Medicare has approved it. So it is a supplement to your insurance. Your primary insurance is Original Medicare, and this supplements it. It is not health insurance. It is not health insurance. It pays as long as Medicare approves it. So when we start talking about the 20% in after the Part B deductible, the 20% on Medicare on Part B. Oops. Again, it's going to end up paying 100%, but there's different plans. There's different plans out there. Now, each insurance company offers different ones in different places. Typically, what we end up having is a G, K, L, and N. Now, when we get over here on the N, you can see it's got some asterisks down here, and it says Plan N pays 100% of Part B coinsurance, except for copays of up to $20 for some office visits and $50 for emergency room. So this one, Plan N, is going to be less expensive, a less expensive premium than Plan G, but you are taking on more of the exposure. You're taking on more of the responsibility. So again, this is all a trade-off. If you're willing to pay for this, then we don't have to cover it, so we can charge you less. So in conclusion, there is no better way to administer your Medicare. We just have two different ways to do it. It's not confusing. It's not confusing. As you can see, when we break this down, it is not confusing how to do this. I have Original Medicare. Do I want to keep them as primary? Yes, I do. Okay, do I want a prescription drug plan, and do I want a Medicare supplement or Medigap plan? There you go. Simple as that. I have Original Medicare. I want a Medicare Advantage plan. We go to the insurance company and we go ahead and do that. Or you call somebody like me and we get it together and we go with that insurance company. And that's as simple as it is. Where we're getting confused is when you're being bombarded with all of this information about here are our different plans. And it makes it seem like a Medicare Advantage plan is actual Medicare. It's not. Everything starts with Original Medicare. Everything starts with Original Medicare, and then we build onto that. We just depends on how we want to go ahead and build on it. So that's really it. And there are pros and cons. We're seeing provider-wise, I would tip the scales in the way of Original Medicare. Ease of going and getting services, I would tip it in the side of Original Medicare. Value, the amount of money you're going to spend, the amount of benefits you're going to get, I would definitely tip that in the scales in the favor of Medicare Advantage plans. So that's what you have to do. This is what you do at this time, or when you're coming into Original Medicare, is what's a priority to me? If you want to go to Mayo Clinic, okay, guess what? They don't take Medicare Advantage plans. So you have Original Medicare, and that's the one you can use over there. So if that's your big thing, then we're typically not looking over on the Medicare Advantage side. We're looking over here on, okay, what supplement do we want to go ahead and have with this? That's as simple as it is. Everything you're getting in the mail is just advertising at this point. It's just advertising for their different products. So keep it simple. And if you got any questions, please put them in and I'd be happy to go ahead and answer some.
Yeah, so I have a question here. If you have Medicare Advantage plan, can you easily move to original Medicare? Let me change back to your speaker.
So you want me to repeat that? Or you, oh, okay. So the answer to your question as you've written it is yes. But yes, but with the Affordable Health Care Act, you cannot be discriminated against for health issues anymore with your health insurance. Okay, so when we're looking at this slide, what components are health insurance? Part A, Part B, Part D, Part C, those are all health insurances. What is not a health insurance? The Medicare supplement, the Medigap plan. So the way you ask the question, can I go from an Advantage plan to original Medicare? Yes, you can. Where the challenge, and you can get a prescription drug plan. No questions asked. It's the Medigap that we need to get, that will be underwritten because it is not health insurance, it's supplemental insurance. So I can move you over to original Medicare. It's just, let's see whether or not we can get through underwriting on the Medigap plan. But to also answer your question, then if you're going from original Medicare over to a Medicare Advantage plan, again, health insurance over to health insurance, as long as we're in an eligible enrollment period, no problems at all. No problems at all. Or if you want to go from one Advantage plan to a different Advantage plan, no problems at all. No, guaranteed.
Another question, you said that the Medicare Advantage doesn't have emergency coverage outside the United States, but if you're outside your local network and you need emergency service, how is that handled?
Okay, so I apologize if I said it that way. You do have emergency room and urgent care worldwide. So you can go and get care outside of the United States, but again, you've got to bring it stateside and pay that premium yourself. So was that the answer?
But let's say I have Medicare. So if I have a Medicare Advantage program whose network is Santa Fe and I'm in Oregon and I have an emergency, how is that covered?
So it's going to be covered, and we go back to our benefits. And if, let's say, I'm going to use a number, let's say the copay for emergency room on your policy is $90. So you just go to any emergency room. You've just got to make sure it's an emergency. But most of the time, none of us are going to go to an emergency room and go through all of that without it being an emergency. But you just go to any emergency room, and they end up having to go ahead and they'll file a claim just like it. And as long as they code it properly, and again, we get back to our wonderful coding, as long as they code it properly, then you will get it covered for the $90. Now, when I say code it properly, I had somebody who went in to Presbyterian. They had a plan that covered Loveless, and they didn't get coded. It was through the emergency room, but it didn't get coded as emergency room entrance. And so suddenly everything was being denied because you went out of network. Okay, so we had to go back and get that reestablished as an emergency room, and then everything was covered for the copay. So just go to anybody. Don't try to find somebody. You don't have to find somebody who's in your network.
So the other thing is, kind of ties together two questions. So there's so many Medicare Advantage plans. So it must be lucrative for the companies to offer these. And is it going to be a situation that in the future original Medicare will go away?
That's a loaded question on many levels. Maybe. It is extremely lucrative. It's extremely lucrative for these Medicare Advantage, for the insurance companies with their Medicare Advantage plans. Everything has a star rating on the Medicare Advantage plans. So there's 5 stars is the maximum you can get. So you can look and see what the quality is or what people thought of the plan the year before. If it comes in at a 3.5 star, okay, that's a pretty good plan. If you go below 3 stars, now Medicare starts getting a little prickly because they want to make sure you're giving some quality service. So, but if you change your star rating even by a 0.5 star, what happens is, again, now the higher you have your star rating, the more reimbursement you'll get from the Centers of Medicare and Medicaid. So a 0.5 star increase can literally mean millions of dollars for an insurance company. Thus, a 0.5 star decrease ends up being where you can cost them, they can lose out on $1 million. So everybody says, well, okay, finally I'm through with the annual election period. Nobody's going to call me. The next thing you know, you start getting calls from your insurance company that you have because they're trying to offer all of these services. Now, they're always voluntary, but that's what they're trying to do, is give you service so you'll give a higher rating for this, because that can end up being very lucrative. There is but I will say that there are some insurance companies, and it doesn't take much Googling out there or research to find out where they are being questioned and investigated by the Centers of Medicare and Medicaid as to what they were stating they needed to get reimbursed from. So again, it ends up becoming that area where we got to see what kind of reputation the insurance company has. I personally, let me say it this way. I personally don't see Original Medicare going away, because it's just too large of something to go away. The Centers of Medicare and Medicaid, who administer your benefits, and Social Security Administration, who handle your premiums and your enrollment. I mean, they're just too large of a department, and typically in governmental departments, they don't reduce them, they increase them. So for that reason, I don't see that. But there certainly is an awful lot of talk sometimes in Washington, D.C. about not doing Original Medicare and just having everything through a Medicare Advantage plan policy. And without getting all political, I mean, again, it doesn't take much research to find out who some of the biggest lobbyers are. So I don't think so, but it is something that if it goes away, then we let it happen that way. It's our own fault.
We had a question about the donut hole, and I think it probably more applies to Medicare Advantage. Is that still a problem in the donut hole?
You know what? That's actually a good question, because when we're at this Part D over here, that's a separate policy, and the Part D over here that's embedded in the policy, they are the same Medicare Advantage plan. Medicare prescription drug plan. So we have the same requirements. Now, they may charge differently. One may have a different deductible. One might not have a deductible. But what we get ourselves into is they all end up dealing with the 3 different levels. We used to call it the donut hole. That's the affection. So the proverbial donut, you start at one end, you get something, you get to the middle, you get nothing, and you get to the other side and you end up getting something else. So that was how it used to be when this all started, that if you got to that second category, you got nothing. You had to pay for everything 100%. Now things have gone ahead and changed to where you will only have to pay 25%, but you still have your 3 different sections. The first section is the initial coverage. That is where you'll take care of your deductible and you'll pay co-pays and co-insurances, and the insurance company will keep track of what you've spent and what they've spent. So, and when those 2 totals reach in 2024, it's going to be $5,000. When they reach $5,000, then we move into the second category, which is the gap coverage, or used to be known as the donut hole. And that is where now all of the co-pays and co-insurances go away. And now you're typically just paying 25% of the cost of your prescriptions. So that can work one way, and another way it can't work. I mean, if you have a tier 1 prescription with a 0 copay and you get into the gap coverage, okay, let's say that the prescription costs $10. Now you're going to have to pay $2.50 for it. But it can work to your advantage also, because some of those higher tiers in the prescription drug plans can be like you have to pay 40%, 50% of the drug. So if you're paying 50% of a drug when you get into the gap, and now you're only paying $25% of it, you just cut your price in half. And then it keeps track of it gives you credit from what you spent in the initial coverage, and then it tallies on top of that, in addition, the 25%. And then that's when we get up to like $8,000. If you get up to that point, then you go into the third level, which is the catastrophic. And at this point, I mean, it's very inexpensive to get your drugs at that point. So, but you have the same design is true on each of these. But on your Medicare Advantage plans, a lot of times they don't have deductibles on their prescription drug plan. Why? To make it very desirable on how you can go ahead to come into their plan. Did you have a question?
So Medicare the Medicare Advantage, my Signet plan is going away, at least part of it. So January 1st, by January 1st, I have to find somebody else. So there's a disadvantage to Medicare Advantage.
Yes. So when Medicare Advantage plans, they are, it's all a state run. So we were talking about a service area. So everything insurance is handled on the state by state basis. And so in order to operate in a state, you have to go through what we call the Office of the Superintendent of Insurance. A lot of other states just call it the Department of Insurance. And you have to get them the information. They have to review it and accept that you can do business in their state. So there are requirements for all of these, for these Medicare Advantage plans to end up being here. So when we were talking about the 4 items that we got from ABC Insurance Company, these all had to be run through the Office of the Superintendent of Insurance and get approval to go ahead and have it. And you have a certain time frame to do it. If you don't have that time frame or you missed your deadline, now suddenly they're not going to go ahead and approve it typically. And so we can have these problems with a Medicare Advantage plan where I'll use the word, they could be more volatile. And I want to be very gentle on that word because they can change. they can change a lot in their benefits, because again, we're getting back to that scale of, if you want more for your dental allowance, well, something else has to give on the other side. There are plans now, Medicare Advantage plans, that will actually pay you back some of your Part B premium. Fantastic idea. But if you start to look at your benefits, you're going to lose an awful lot on the benefit side. I see it where it is almost twice as much on the copays on these plans. But again, it's not what's best for you. If you don't go to the doctor and you want to go ahead and get some money, and the $164.90 is an issue, go on one of these plans. And that's the value of it, is they have so much to offer. But again, ABC Insurance Company here on the 5th day is sending us now a brochure on their Give Back Medicare Advantage plan, and it says you can get it back, you can get money back from of your Part B premium. And you're like, well, wait a minute, I didn't see that on any of the other stuff, because it's a separate product. So yeah, I agree. You have to keep an eye on things, and when they go out, okay, that really is very disruptive, and they go out of here for different reasons. Sometimes they didn't get their paperwork in on time. Sometimes they can't make a living here, or their living as much, or their profit. And so they just go and say, we're not going to do business in that state anymore. So they come and they go, they change every year. That's why it's so important to go ahead and look at your annual notice of change on a Medicare Advantage plan, because what are my differences from this year to the next year? This year, we have a Medicare Advantage plan that was offering 80 hours of actual home health care. I thought it was an unbelievable benefit being offered. Guess what? 2024, that's going away. Why? Because they needed, something had to give, and this is what they gave up so that they could keep their prices down and keep a zero premium. So that's the game that ends up being played, and sometimes you win and sometimes you lose. So yeah, that's why it's imperative that you review your stuff on an annual basis. We don't really get into that on this side of things, because when we get back to that slide of it pays 100%, well, okay, if the 2023 deductible for going inpatient is $1,500, okay, it'll pay 100% of a Part A deductible. It's raising up to $1,600. Oh, I'm sorry, the 2023 is $1,600. Last year was $1,500. So we're not really concerned about what you're losing in benefits, because you're not losing anything in benefits on this side of things, because it is still going to pay 100%. So if it even goes up to $2,000, it really doesn't matter, because it's going to pay 100%. What matters, though, is can you still afford the premium? So that's where they trade it off to you, is your premium will go up. It's high on those Medicare supplement plans, and it continues to go up. But again, if that's your priority, then that's the more suitable way of looking at it. Long answer for a short comment. Sorry.
We had a question about why is it so difficult to go?
Karen, did you want to ask about why is it so difficult to go from one Medigap program plan to another? She said she had to fill out a health question, then the price came back double to what she's paying.
Okay. Back to that same thing that we're saying. What is health insurance? That's a guaranteed issue. Part A, Part B, Part D, and Part C is the health insurance. What isn't health insurance? The Medigap, the Medicare supplement plan. They will underwrite you. What we mean by underwriting is that they can go ahead and assess what your medical risk is, and they can charge accordingly. So Karen, what happened then was that you ended up submitting, and probably your premium was getting high, so you wanted to go ahead and see if there was something else out there. Yes, if you were completely healthy, then it might lower your premium a little bit, but they found some stuff out, or you might, if they are incorrect, you're going to have to dispute it. But then they came back and said, well, we'll offer you one, but it's going to be at a higher rate. So they feel like they have to get this higher premium in order to offset their exposure. Because again, if you're paying 100% of the Part A deductible and it keeps going up every year, okay, and you look, and somebody has to get a triple bypass surgery. All right, well, now they're going to be out a lot more money. So that's kind of what ends up happening, is that's what we mean by underwriting. And I will go so far as to say they can even deny you coverage. So in one way, you're lucky that you were able to get an offer, but in another way, it really wasn't worth it for you to go ahead and move from one Medicare Medigap plan to another Medigap because of the cost. So when you turn 65, the Medigap Medicare Advantage plans are a guaranteed issue. So you can get in, no questions asked, and you're in as long as you pay your premium. Once we're past that first year on the Medicare supplement plans, if we look at other Medicare supplement plans or anything like that, they're going to ask you more questions for the underwriting. So unfortunately, like I said, glass half full, they offered you it. But when we get back to that, the slide about what's covered, you're not getting anything different from one insurance company to the other. So certainly would recommend you stay with your insurance, your Medigap plan, as long as you can with your current, because we know now that you're going to get an increase or a rate up, they'll call it, if you try to change. But since we're talking about it, if you decided, Karen, that you wanted to look and see where all your doctors are and go to a Medicare Advantage plan, okay, now suddenly we're not paying the premium for the Medicare supplement plan. We're not paying the premium for the Part D. I mean, you can see the value in the Medicare Advantage plans. Is that it?
So, does anybody else?
But I don't know if you want to address that later. I believe one time you said that the anesthesiologists don't always wait for what you owe to go through the system. And that's what happened to me when I had my last colonoscopy. So I want to know if next time I'm gonna go in, if I can say to the anesthesiology people, please do not put this through until it's gone through Medicare and my Blue Cross.
Well, so the question is can you ask providers not to submit their bills to you until it has completely gone through the insurance process? And the answer is no, because their businesses and their setup to accounts receivable is huge in hospitals and practices. That's where a lot of their value, that's where a lot of their revenue is tied up. So they have it set where on every 30-day basis, they're sending out on their system, it says you owe this. Some could be a little bit more understanding. I would agree with you. And but I'm glad you caught that and was able to go ahead and obviously you got it taken care of so that they ran it through. Because guess what? On any of this Medicare, if you don't protect yourself, then you're the one who's going to have to pay for it. Now, we can get into certain coordinators and stuff over on the Medicare Advantage plan. Again, another added value into the Medicare Advantage plans. But if you don't watch out for yourself, they may say they're watching out for you, but you'll be left with the bill at the end of the day. So watch yourself.
I think the last one is, somebody was asking that they have a Medicare Advantage plan with a 0 premium, and they're very happy with it, but would it make sense as they get older to move to a Medicare supplement plan?
No. The reason is, no. Because okay, let's bring up two scenarios. I'll say initially no, because on the Medicare supplement plan, I mean, just the odds of you having more medical issues the older you get are huge. I mean, they all go up. 5 years ago, I didn't have anything wrong with me. Over the last 5 years, the poop hit the fan. And so this is what ends up happening. So I've got stuff in my history that potentially could come back again. So I would say, for the most part, no, because I don't know if you're going to make it through underwriting, or like in Karen's situation, you'll get one back, but it's double what the price was originally because they've rated you up. Now, with that said, I have had people who feel like there's some stuff that they might have to address the following year, and nothing is going on at this point. So when they talk, when underwriting has asked them these health questions, they can say no, no, no to all of these questions, and they have a clean bill of health. They haven't been, and we don't speculate in this. We have to, the only way you're going to have a medical condition is if a provider has said this to you. So if a provider hasn't said that you have high cholesterol, even though your cholesterol count may be 300, you don't technically have the condition of high cholesterol. Yeah, I have high cholesterol. No, you don't technically have the condition of high cholesterol. So I've had people who have felt like they've got something that is coming down the pipe, and they want to go to a certain facility, and they've looked at what they accept, and they accept original Medicare and not Medicare Advantage plans. And they have gone ahead and enrolled in a Medicare supplement plan for and now they're taking on that responsibility. You have very low exposure under this design because you're only paying the $226 in 2023. And over here, you have continual co-pays that you're going to have to go. Now, with that said, though, I mean, I have had a lot of people who, I've said this before, you have 3 phases of your retirement year. You've got your go-go years, your slow-go years, and your no-go years. So I have been doing this long enough to where I have clients who now are in their no-go years. And where they wanted to go outside of New Mexico to a different facility, now they're like, you know what? I want to stay here. I want to stay near my family. I don't need to travel. I can't travel. So I have a lot of people who will come over from a Medicare supplement plan design over to a Medicare Advantage plan when they're in those no-go years, because now they're saving on the Medigap Medicare supplement premium. They're saving on the Part D premium. So they just freed up monthly, maybe $200-$300 possibly. So, but typically, no, I would say I wouldn't recommend doing that unless, again, there's a certain scenario and you think you can make it through underwriting. And I think that's everything. Yes. So again, if you've got any questions, please, you can direct them towards the Villages of Santa Fe. My contact information is here. I'd be willing to answer any questions about what we're going through, and thank you for this opportunity. I really appreciate it.
There we go. And thank you to Brad and for everybody for participating. We will be having some more programs in 2024. I think our next one is home health care and rehab. So that'll be a very interesting program talking about the different levels of home health care and rehab. And again, just address your questions to Brad if you wish. If you can't get through to him, you can email info@villagesofsantafe.org. Thank you, everybody.